Whether you are running to score a goal in soccer, shoot a hoop in basketball, or stop a try in football, many sports involve repeat sprint ability, and without even realizing it, you perform active or passive recovery during these sports. However, which one of these is really better for you? My name is Erin, and I will be talking to you about the effects of active and passive recovery on physiological and performance responses. There are many sports in which it is a fundamental ability to be able to perform repeat bouts of maximal or near maximal effort, and this is referred to as the repeat sprint ability. These efforts are often required in critical moments of the game, such as saving or scoring a try. A repeat sprint protocol is often used to train this and involves performing a set amount of sprints over a short distance with a brief recovery. There have been many studies conducted in this area, however most have used cycling. During a repeat sprint protocol, the main source of energy is coming from the anaerobic system. In this process, ATP is resynthesized through the breakdown of phosphocreatine. This is a process called glycolysis. During recovery, a series of metabolic processes occur to restore the body. When the recovery time is insufficient and homeostasis cannot be restored, it is shown to be detrimental to performance. While performing high-intensity activities, blood lactate in the body increases. One study which was conducted found this to be higher during active recovery. However, other research has shown that the body uptakes more lactate during active recovery, meaning the levels are lower. Blood lactate is used to explain physiologically what is happening during exercise, and RPE can do this as well, as it has been linked in research to metabolic demands. While some research has found that active recovery assists with recovery due to the removal of metabolic waste, more research favours passive recovery as being the most effective method, with research showing that active recovery impairs performance. This brings us to our aim, which is to investigate whether a difference occurs in RPE, blood lactate, and time between the active and passive recovery methods. The null hypothesis states that there is no significant difference between the active and passive recovery. Furthermore, the alternative hypothesis states that there will be a significant difference between active and passive recovery. 9 fit and able students volunteered themselves to participate with their demographic information listed below. All participants completed a pre-health screening and were informed of the protocols and any risks, giving their informed consent prior to any testing. This randomized crossover study was designed to compare active versus passive recovery during a repeat sprint protocol. During each testing session, participants were randomly allocated a recovery method to avoid bias. The passive recovery method involved 10 maximum 20-meter sprints with 30 seconds of passive recovery. The active recovery protocol was the same, rather participants completed a jog at 50% of their maximal effort during the recovery time. Physiological measures were required throughout the protocol, including RPE, sprint time, and blood lactate. The participants were given 24 hours of recovery time in between each protocol. The participants then completed a controlled warm-up, including 5 minutes of jogging at 50% of their maximum effort, followed by a set amount of dynamic stretching. Prior to testing, blood lactate measures were taken, as can be seen in Figure 1. This was repeated at the end of the protocol and 5 minutes after. The rate of perceived exertion was also taken at the beginning, as well as after each sprint, using Borg scale. For the sprint protocol, Fusion Sport timing lights were used to record the time, and were set up at 0, 5, 15, and 20 meters, the setup of which can be seen in Figure 2. The participants completed 10 maximal 20-meter sprints, and were delegated to perform either active or passive recovery at the end of each trial. Figure 3 shows a participant completing the repeat sprint protocol, while Figure 4 shows the active recovery course being measured out for an individual. At the conclusion of testing, the data was compiled with the means and standard deviations being found for each outcome. Paired t-tests were used to determine if there was a difference in the times and RPE between active and passive recovery, with the alpha level set at 0.05. Furthermore, a repeated measures ANOVA was used to determine if there was any significance in the blood lactate measures. Paired t-tests were then used with the Bonferroni correction to give a more detailed view of where the differences occurred. All of these analyses were conducted using Microsoft Excel. The means and standard deviations for the RPE, blood lactate, and sprint times can be seen in Table 1. Figure 5 shows the mean and standard deviation for the RPE, with the RPE being found on the y-axis and the recovery method being found on the x-axis. It was found that there was a significant difference between active and passive recovery, with active recovery having a higher rate of perceived exertion than passive recovery. The results found a difference in the blood lactate levels, with active recovery having significantly higher levels in blood lactate after testing and 5 minutes after testing. A difference was also found between the 3 time points blood lactate was measured, with significant differences being found between the pre and post test and pre and post 5 minutes test for both active and passive recovery. The results for the sprint times can be seen in Figure 6, expressed as the mean and standard deviations. The time can be seen on the y-axis, with the recovery method on the x-axis. It was found that the active recovery times were significantly slower than the passive recovery times. There has been little previous research comparing the ratings of perceived exertion with active and passive recovery. The results of this study found RPE was greater in active recovery than in passive recovery. A previous study found that RPE decreased during active recovery. However, the time of recovery for this study was much greater. RPE has been closely linked to metabolism and can be used to establish and monitor exercise intensity. Although this is most common using heart rate, one study has found a correlation between RPE and blood lactate. Previous research has found that blood lactate increases while performing short periods of high-intensity work, such as a repeat sprint protocol. During this study, blood lactate increased for both active and passive recovery, for the pre and post, as well as the pre and post 5-minute measures. During anaerobic work, blood lactate accumulates, increasing the acidity in the blood and muscles. This can be seen in the results for the active recovery, with a large increase in levels post and post 5 minutes. These high levels of blood lactate are an indication that participants have not had sufficient recovery, and it would no doubt have been a detriment to their performance. One study did find that blood lactate decreased during active recovery, and this is once again due to a longer and less intense recovery time, which would have seen an increase in lactate uptake in the body. There have been minimal studies which have looked at running-based repeat sprint protocols. The results for this study found a significant decrease in the sprint times for participants when they were performing active recovery. One study which did assess active and passive recovery in a running repeat sprint protocol found similar results. Their study, conducted on a treadmill, found a decrease in the mean speed time. They also found there to be a high percentage of speed decrement, something that was not looked at in this study, but could potentially be assessed by looking at the split times. It can be concluded that active recovery has shown to have a detrimental effect on performance, and therefore performing active recovery at 50% of maximal speed is not an effective method of recovery. Active recovery significantly increased RPE, blood lactate, as well as the sprint times of participants. These are all indicating that it is not physiologically effective due to insufficient recovery time. The metabolic processes cannot be restored to an adequate level to perform well. As it was concluded that active recovery is detrimental to performance compared to passive recovery through physiological measures, coaches would benefit from using passive recovery. Thank you for listening.